Hello children, good morning. I'm Dr. Hema Harris. Today we shall see the lymphatic drainage of head and neck. So first we have to know what is a lymph. Lymph is a colorless fluid which is formed from the interstitial fluid that seeps through the thin walls of capillaries into the body's tissues. What does that mean? You know what capillaries are. They are thin walled tubules which are lined by single layer of squamous epithelium or flattened cells. On one end of the capillaries we have arterioles, and on the other end of the capillaries we have venules. So when blood passes from the arterioles into the capillaries and into the venules, when the blood reaches the capillaries, some of the fluid, not the blood as such, some of the fluid leaks out of the capillaries into the surrounding body's tissue. So this fluid that is leaking out of the capillaries is colorless because they do not have the red blood cells. This fluid, the colorless fluid that is coming out of the capillaries and nourishing or bathing the surrounding tissue is called lymph. This colorless lymph, what does it contain? It contains white blood cells, contains oxygen, some of the necessary proteins which can seep through the capillary wall, and other nutrients which are required for the functioning of the body. So some of these nutrients and the oxygen which are seeping out and are present in the lymph will be nourishing and providing oxygen to the surrounding tissue, and once that work is done, some of this lymph will re-enter the capillaries, but most of it will enter another channel which is a tubular channel similar to the arterioles and venules. There is another tubular channel which is part of the circulatory system, and that is called the lymphatic vessels. So the lymph comes out of the blood vessels, out of the capillaries, and it is colorless. It consists of white blood cells, proteins, oxygen, and other nutrients. After nourishing the tissue, the major amount of it will enter a separate system called the lymphatic vessels. So that is what we call as a lymph. You can see the arterioles, then you can see the capillaries and the venules. What you see in green are the lymphatic vessels. So the green arrow shows the the lymph seeping out of the capillaries and they're entering into the lymphatic vessels. So that is how the lymph is formed. So the lymphatic system, it is made up of a network of lymphatic vessels which drain into the lymph nodes, and then there are also lymphatic or lymphoid organs. So these lymphoid organs are concerned with the immune system because they produce B cells, T cells, etc., which are necessary for the immune response of the body. So lymphatic system is considered as a part of the circulatory system as well as the immune system. So here we can see the various lymph nodes in the body. Can you see here? These are whatever is marked in green are the lymphatic vessels. These lines, they are the lymphatics or the lymph vessels which are carrying lymph from the lower part of the body. And these nodes, these green aggregates here, they are the inguinal lymph nodes, and further up you have the pelvic lymph nodes. Then what happens here, we can see this on either side of the lumbar vertebrae we have the lumbar lymph nodes. So lymphatics from the lower limb will collect all the lymph from the lower limb, relay at the pelvic nodes or the lumbar nodes, and from there the lymphatics which goes up will be the cisterna chyli, which continues as a thoracic duct, and thereby the lymphatic from the lower part of the body is taken to the upper part where it finally drains into the veins, into the large veins. Similarly, we have these are the lymphatics of the upper limb. These are the lymphatics of the mammary gland. They will drain into the axillary group of lymph nodes. Also, from the head and neck, there is drainage into the cervical group of lymph nodes. Here there is a thymus. Thymus, spleen, etc. are the lymphatic organs we mentioned earlier. So this gives a brief idea about the lymphatic system of the body. So here we can see that out of the 800 lymph nodes in the body, about 300 lymph nodes are located in the region of head and neck. So that shows what an extensive lymphatic system we have in the region of the head and neck. So we can broadly classify cervical lymph nodes into two groups. That is a superficial group, which is also called the peripheral group of lymph nodes. Okay, so the peripheral group of lymph nodes, as we can see, they are all in the periphery. They are like outside the parotid gland, along the submandibular region, along the submental region. So these are the peripheral group of lymph nodes. They are also called superficial or outlying lymph nodes. Whereas there is a deeper layer also. They are called the deep cervical lymph nodes or terminal group. So the deep group of lymph nodes will be lining along the internal jugular vein in a deeper strata. So we can see that there will be a superficial group which is lying along the parotid region, along the occipital region, along the submandibular and submental region. These are all in the periphery, so they are called superficial nodes, whereas the deep cervical nodes or the terminal group are those which are lying along the internal jugular vein in a deeper strata. All the lymph from the region of the head and neck. Okay, so from wherever it is, whichever node it is, whichever region it is, all the lymph will ultimately drain into the deep cervical lymph node. So this drainage can either be direct or indirect. Direct drainage means from various part of the head and neck region, the lymph will come and drain directly into the deep cervical lymph nodes. Or what can happen is the lymph can pass into one of the superficial or the outlying group of lymph nodes, and from the superficial group of lymph nodes they can drain into the deep cervical lymph nodes. So ultimately what happens is all the lymph has to end up in the deep cervical lymph node. That is the essence of it. So either directly or indirectly, all the lymph from the region of the head and neck has to end up in the deep cervical lymph node. So the lymphatic system, it is made up of a network of lymphatic vessels which drain into the lymph nodes, and then there are also lymphatic or lymphoid organs. So these lymphoid organs are concerned with the immune system because they produce B cells, T cells, etc., which are necessary for the immune response of the body. So lymphatic system is considered as a part of the circulatory system as well as the immune system. So here what do we see? We see whatever we had said earlier. This is the right internal jugular vein. This is the left internal jugular vein. This is the left subclavian and this is the right subclavian vein. Okay, so here what happens? We can see the green jugular trunk. This is the right jugular trunk coming from the cervical region or from the head and neck region, and this is the left jugular trunk which is also coming from the left head and neck region. Now, this jugular trunk joins with the subclavian trunk. Subclavian trunk is, what is it doing? It is draining lymph from the upper limb. Okay, so this is the subclavian trunk on the right and the subclavian trunk on the left. Thoracic duct is draining lymph from the lower part of the body, that is from the abdomen and pelvis. There is a bronchomediastinal trunk on either side draining lymph from the thoracic area. So here what happens, from the head and neck, the jugular trunk comes and joins with the subclavian trunk on either side, and they drain into the junction between the internal jugular vein and the subclavian vein on either side. On the left side, additionally, we have the thoracic duct also. So this is the area of final drainage. There is a junction between the internal jugular vein and the subclavian vein. So now let us talk about the peripheral group of lymph nodes. Peripheral group of lymph nodes are arranged in two circles. There is an outer circle and an inner circle. So this, what you can see here, this is the outer circle. Okay, so this is the outer circle and this is the inner circle. So this inner circle is actually deeper to the outer circle. It has to come inside. Okay, so this outer circle, as we know, it will be more towards the periphery. Among the peripheral lymph nodes also, outer circle will be more peripheral than the inner circle. So we have two groups, peripheral lymph nodes and deep lymph nodes. We're talking about the peripheral lymph nodes. Peripheral lymph nodes also arranged into two groups, an outer group and an inner group. What are the outer group? Outer group are the submental, whatever we are seeing in the most periphery at the junction of the head and the neck. So it forms a kind of collar at the junction of the head and neck in a circular pattern, like this from front behind. We can see in front we have the submental lymph nodes, slightly laterally we have the submandibular, near the ears we have the preauricular, behind the ears we have the postauricular, and behind we have the occipital. So this is an outer circle of the peripheral lymph nodes. Okay, so we can see again, it is seen at the, if you trace it, we see that it is at the junction of the head and the neck. Now let us see what are the outer circle. Outer circle, as we said, it is a pericervical collar. Pericervical means what? Around the neck. It is a collar which is formed around the neck. So here, first we can see, what we see here is a submental. Behind, this is a submandibular. Slightly above and in front of the ear, we can see the preauricular or the parotid group of lymph nodes. This is the ear. So behind the ear, there is a postauricular or retroauricular group of lymph nodes, and at the occiput, there is a occipital group of lymph nodes. So this forms a kind of collar around the neck. Hence, it is called the pericervical or a cervical collar, and it is seen at the junction of the head and the neck at the craniocervical junction, extending from the chin to the occiput. So this is the submental. Here we have the submandibular. Then we have the parotid. Behind the parotid we have the retroauricular, and posteriormost we have the occipital. Now we can see that this is forming a sort of a chain, right? A collar. So that is why it is called a pericervical collar. Here once again we can see what are the lymph nodes of the outer circle. Submental, there is submandibular, next is superficial parotid or preauricular. What we have next is, what is next? Mastoid or postauricular, and last is the occipital. So these are the lymph nodes which form the outer circle of the peripheral group of cervical lymph nodes. I hope that is clear. Now there are some of the extensions of pericervical collar are certain lymph nodes which are seen close to the lymph nodes forming the pericervical collar. That means these lymph nodes are not seen along with the lymph nodes which form the pericervical collar, which are there like the submandibular, submental, parotid, etc. But they are seen close to these nodes. So these extensions are called offshoots of some of the nodes forming the pericervical collar. You will understand when I explain once more. Some of these nodes are, first you can see a group here called the facial group. So facial group, we had not mentioned facial group as part of the peripheral group forming the pericervical collar. But this facial group you can see here, it is an offshoot or it is a part of an extension from the submandibular group. So this is an offshoot or extension of the submandibular group of lymph nodes which is forming part of the pericervical collar. Similarly, here you have the superior jugular group, which is also called the superficial cervical nodes. So there are a group of nodes called the superficial cervical nodes, which are actually seen as offshoots of the superficial parotid group of lymph nodes. So you have facial group, superficial cervical group, and anterior cervical group. So these are the anterior cervical group of lymph nodes. So these nodes are considered as offshoots or extensions of the pericervical collar. Let us see each of these nodes, which are extensions of the pericervical collar. First, facial nodes, also called buccal nodes. These are offshoots of the submandibular nodes. They lie on the buccinator muscle and are related to the facial vein. So these facial nodes, they collect lymph from the face, and then the lymph from these facial nodes is drained into the submandibular nodes. And we had said earlier that ultimately all the lymph from the head and neck should reach the deep cervical group of lymph nodes. Deep cervical group of lymph nodes are divided into an upper group and a lower group. That is upper deep cervical and lower deep cervical. You will know that in detail when we come to deal with the deep cervical group of lymph nodes. Right now we are handling the peripheral group of lymph nodes. So what happens once again, from the facial nodes drain lymph from the face, and from the facial nodes lymph drains into the submandibular node, and from there it will drain into the upper deep cervical nodes. Whereas in case of superficial cervical nodes, they are seen as offshoots of the superficial parotid nodes. And where do they lie? They lie, these superficial cervical nodes, they lie superficial to the upper part of sternocleidomastoid, and there it is related to the external jugular vein. So what does this node do? It collects lymph from the parotid nodes, ears, and the adjoining part of the face, that is the lower part of the face, and from there what it efferents are drained into the lower deep cervical nodes. So superficial cervical nodes will collect lymph from the parotid nodes, and then it drains into the lower deep cervical nodes. In case of anterior cervical nodes, they are arranged along the anterior jugular vein. And what do? They receive afferents from the skin and muscles of the front of the neck, that is in the anterior triangle of the neck, and they drain into the lower deep cervical nodes. Some of these anterior cervical nodes also form the suprasternal nodes in the space of Burns. We know there is a space called the space of Burns in the suprasternal region. That space is called suprasternal space of Burns. And there are a few lymph nodes which are formed by the anterior cervical nodes. We have to know the drainage areas of each of the lymph nodes constituting the outer circle or the pericervical column. First is the submental node. Submental nodes are about 3 or 4 in number. They are located in the submental triangle. What are the boundaries of the submental triangle? We know that the apex is formed by the lower border of symphysis menti, base is formed by the hyoid bone, and the sides are formed by the anterior belly of digastric muscles. Floor is formed by mylohyoid muscle. So these submental nodes are resting on the mylohyoid muscle in the submental triangle. Area of drainage of the submental nodes, they drain a small wedge-shaped area. Not so small, but still it is small compared to the submandibular region. So this is a wedge-shaped area which covers the tip of the tongue, floor of the mouth, the gums opposite the lower incisors, and central part of the lower lip. From all these areas, the lymph is drained and into the submental nodes. And from the submental nodes, efferent vessels or efferent lymphatics drain these lymph into the submandibular node, and from there into the deep cervical lymph nodes, of which predominantly it is jugulo-omohyoid group of deep cervical lymph nodes. Next important nodes are the submandibular nodes. Submandibular nodes are located in the digastric triangle. What are the borders of the digastric triangle? Above we have the lower border of the body of mandible and a line extending from the angle of mandible to the mastoid process. That is a demarcation above. Below and behind we have the posterior belly of digastric and the stylohyoid muscle. Below and in front we have the anterior belly of digastric. That is the boundary of digastric triangle. One of the important contents of the digastric triangle is a submandibular gland. So the superficial part of the submandibular gland is present in the digastric triangle, and these submandibular nodes are embedded on the submandibular salivary gland. Submandibular nodes are usually about 3 in number. One will be present at the anterior end of the submandibular gland, and the other two will be seen behind. Okay, one in front and one behind the facial artery. So we know that the facial artery is there towards the posterior part of the submandibular gland, and one of the lymph nodes will be seen in front and the other one will be seen behind the facial artery, whereas the third one we said will be seen towards the anterior end of the submandibular gland. So there will be 3 submandibular lymph nodes usually, one seen at the anterior end of the submandibular gland and the other two seen, one in front and one behind the facial artery. Here we have the drainage area. It is a large wedge-shaped area. So if you draw a line joining the medial angle of the eye and the angle of the mandible. So an imaginary line drawn from the medial angle of the eye and the angle of the mandible. The region below that is drained by the submandibular nodes. Then the submandibular as well as the submandibular and sublingual salivary glands. Coming to the side of the nose, anterior 2/3 of the tongue, floor of the mouth, whole of the upper lip, lateral part of the lower lip, the teeth and gums, and 3 sinuses. They are the frontal, maxillary, and ethmoid sinuses. So there is an extensive wedge-shaped area which is drained by the submandibular nodes. So we know that the submandibular nodes are the peripheral lymph nodes. So from the peripheral lymph nodes, lymph has to ultimately drain into the deep cervical nodes. So from submandibular node, efferents drain into the deep cervical nodes, of which it is mainly jugulo-omohyoid and partly the jugulo-digastric nodes. Next are the parotid nodes. Parotid nodes are superficial and deep nodes. Now they lie either on or within the parotid gland. Those which are lying on the superficial part are called the superficial parotid nodes, and those which are deeply placed are called the deep parotid nodes. So here we have preauricular group or the superficial parotid nodes. They are seen in front of the tragus of the ear. They drain the upper part of the face, so the area that is related or close to the parotid gland. Upper part of the face, anterior part of the scalp, then close to the ear, so external acoustic meatus and the pinna. These are the areas which are drained by the superficial or the preauricular group of parotid nodes. They are the upper part of the face, anterior part of the scalp, external acoustic meatus and the pinna. Efferents, we had said earlier, they drain into the superficial cervical lymph nodes. Superficial cervical lymph nodes, they are offshoots of the parotid group of lymph nodes, and they are lying along the external jugular vein. We had mentioned this earlier. So efferents drain from the parotid nodes. The lymph is drained into the superficial cervical lymph nodes, and from the superficial cervical lymph nodes, ultimately the lymph drains into the upper deep cervical nodes. Whereas the deep group of parotid nodes, they are located in a deeper strata in the parotid gland, and the afferents or the area drained by them are the posterior part of the nose, nasopharynx, tympanic cavity, temporal and infratemporal fossa. So the deep group of parotid nodes, they drain the areas which is slightly at a deeper level, like the posterior part of the nose, nasopharynx, tympanic cavity, temporal and infratemporal fossa. From all these areas, afferents reach the parotid nodes. And from the deep group of parotid nodes, efferents arise and they drain the lymph into the deep cervical lymph nodes. Next set of nodes present in the pericervical or the peripheral group are the mastoid nodes. Mastoid nodes, they are also called retroauricular nodes because they are found behind the ear. Parotid nodes are the preauricular nodes and the mastoid nodes are the retroauricular nodes or the postauricular nodes. They lie superficial to the sternocleidomastoid. Okay, they lie on the mastoid process, superficial to the sternocleidomastoid, but deep to the auricularis posterior. The afferents, that is the area drained by the mastoid nodes. From the scalp, from the pinna and from the posterior wall of external auditory meatus, lymphatics drain into the mastoid nodes. So the afferents arising from the scalp, pinna and the posterior wall of external acoustic meatus will reach the mastoid nodes, and from the mastoid nodes efferents arise and they drain the lymph from the mastoid nodes into the upper deep cervical lymph nodes. So we know that the submandibular nodes are the peripheral lymph nodes. So from the peripheral lymph nodes, lymph has to ultimately drain into the deep cervical nodes. So from submandibular node, efferents drain into the deep cervical nodes, of which it is mainly jugulo-omohyoid and partly the jugulo-digastric nodes. Last group of nodes in the pericervical collar are the occipital nodes. Occipital nodes are located at the apex of the posterior triangle. So at the apex, which are the two muscles which meet? We have the trapezius and the sternocleidomastoid. And these occipital nodes lie superficial to the trapezius and they are related to the occipital artery. Which are the areas drained by them? They drain the back of the scalp and lymph from the skin of the back of neck. So from these areas, afferents arises and afferent lymphatics reach the occipital nodes. From there, the efferents drain the lymph into the supraclavicular nodes. So you remember seeing supraclavicular nodes during we learned about the supraclavicular nodes during our dissection of the posterior triangle. So the supraclavicular nodes are located in the posterior triangle. So here the lymph from the occipital nodes are carried by the efferent lymphatics and the efferent lymphatics carry them to the supraclavicular nodes. Now we will talk about the inner circle of the superficial group of lymph nodes. We are still talking about the superficial group. Okay, so we said there are cervical groups. Cervical group of lymph nodes are of two groups. One is superficial group and this deep group. Superficial group has a outer circle which is called the pericervical collar or the outer circle and an inner circle. Now we have completed the pericervical collar or the outer circle group of cervical nodes which belong to the superficial group. Okay, now we're talking about the next circle, that is the inner circle, which is also part of the superficial group of cervical lymph nodes. So which are they? We have the infrahyoid nodes. This is the hyoid bone. These are the infrahyoid nodes. Prelaryngeal nodes. So those which are lying in front of the larynx, they are the prelaryngeal nodes. Pretracheal nodes, the ones here in front of the trachea, are the pretracheal nodes. Paratracheal nodes means on either side of the trachea. Paratracheal nodes are on either side of the trachea. And then here we have the retropharyngeal nodes. These nodes which are behind the pharynx, those are the retropharyngeal nodes. So this is the inner circle. So these are on either sides. Okay, so we have the infrahyoid bone, prelaryngeal and prelaryngeal and pretracheal in the center, paratracheal on either side, and retropharyngeal behind. Okay, so that forms a inner circle. So here we can see the inner circle. Okay, outer circle we had finished earlier. Now this is the inner circle. In front we have the prelaryngeal and the pretracheal in the center. On either side we have the paratracheal. Retropharyngeal will be behind, so that is the circle. Here in between you will have the infrahyoid group of lymph nodes also. So this is the inner circle, which is part of the peripheral, or which is part of the superficial group of lymph nodes. Pretracheal, paratracheal and prelaryngeal nodes, they drain the larynx, trachea, esophagus and thyroid gland. So afferent lymphatics arising from the larynx, trachea, esophagus and the thyroid gland reaches these nodes. Which nodes? Prelaryngeal, pretracheal and paratracheal nodes. So lymph from these areas reaches these nodes, and from these nodes, from these prelaryngeal, pretracheal and paratracheal nodes, efferent lymphatics arise and they drain into the lower deep cervical lymph nodes. Prelaryngeal nodes are also called Delphian nodes. Delphian nodes has a clinical importance because at the time of thyroidectomy, these Delphian nodes may be removed. Have you heard of sentinel lymph node biopsy? Sentinel lymph node biopsy means you take when you're doing a surgery of a particular area, and if there is a suspect of a cancer spread, if you're suspecting a spread of cancer, the lymph node of that particular area can be taken and sent for biopsy. So if there is any spread of cancer, or if there is cancer in any other part, and if there is a lymphatic spread, it will be draining into this lymph node which we have sent for biopsy. So for each area we will have different lymph nodes which are called sentinel lymph nodes. In case of this cervical region and concerning thyroid cancer, this Delphian nodes are considered as the sentinel lymph nodes. So for sentinel lymph node biopsy, to identify the risk of cancer spread, Delphian nodes may be removed at the time of thyroidectomy. So we know that the submandibular nodes are the peripheral lymph nodes. So from the peripheral lymph nodes, lymph has to ultimately drain into the deep cervical nodes. So from submandibular node, efferents drain into the deep cervical nodes, of which it is. Now let us see what are the outer circle. Outer circle, as we said, it is a pericervical collar. Pericervical means what? Around the neck. It is a collar which is formed around the neck. So here, first we can see what we see here is a submandible. Behind this is the submandibular. Slightly above and in front of the ear, we can see the preauricular or the parotid group of lymph nodes. This is the ear. So behind the ear, there is a postauricular or retroauricular group of lymph nodes, and at the occiput, there is a occipital group of lymph nodes. So this forms a kind of collar around the neck. Hence, it is called the pericervical or a cervical collar, and it is seen at the junction. Efferents, we had said earlier, they drain into the superficial cervical lymph nodes. Superficial cervical lymph nodes, they are offshoots of the parotid group of lymph nodes, and they are lying along the external jugular vein. We had mentioned this earlier. So efferents drain from the parotid nodes, the lymph is drained into the superficial cervical lymph nodes, and from the superficial cervical lymph nodes, ultimately the lymph drains. Now we will talk about the inner circle of the superficial group of lymph nodes. We are still talking about the superficial group. Okay, so we said there are cervical groups. Cervical group of lymph nodes are of two groups. One is superficial group and this deep group. Superficial group has a outer circle which is called the pericervical collar or the outer circle, and an inner circle. Now we have completed the pericervical collar or the outer circle group of cervical nodes which belong to the superficial group. Okay, now we're talking about the next circle, that is the inner circle, which is also part of the superficial group of cervical lymph nodes. So which are they? We have the infrahyoid nodes. This is the hyoid bone. These are the infrahyoid nodes. Prelaryngeal nodes. So those which are lying in front of the larynx, they are the prelaryngeal nodes. Pretracheal nodes, the ones here in front of the trachea, are the pretracheal nodes. Paratracheal nodes means on either side of the trachea. Paratracheal nodes are on either side of the trachea. And then here we have the retropharyngeal nodes. These nodes which are behind the pharynx, those are the retropharyngeal nodes. So this is the inner circle. So these are on either sides. Okay, so we have the infrahyoid bone, prelaryngeal and prelaryngeal and pretracheal in the center. Paratracheal. So this picture shows a Walde's ring, which is defined as an interrupted circle of protective lymphoid tissue at the upper end of the respiratory and alimentary tract. So it is a ring of interrupted circle. This means it is not continuous, but we have masses of lymphoid tissue which forms a circle if you connect all the tissue together. So it is found in the submucosa deep to the inner circle. We can see that there is a nasopharyngeal tonsil or the pharyngeal tonsil, which is also called the adenoid, which is seen in the midline, above and behind. And below and in front we have the lingual tonsil. On either side we have a pair of tubal tonsils and palatine tonsils, one on each side. So these are the lymphoid tissues which forms the Walde's ring. Lymphatics from the Walde's ring reaches the pericervical collar, and from there ultimately it will drain into the deep cervical lymph nodes. So afferents from Walde's ring will reach the pericervical collar, and efferents from the pericervical collar will drain into the deep cervical lymph nodes. Let us see the functions. I said Walde's ring serves very important functions. One is it prevents the invasion of exogenous antigens, which includes microorganisms. Second, it filters the lymph that is collected from the lymph node of the inner circle. Third important function is that it also produces T lymphocytes and B lymphocytes, which has to be sent to the other lymph nodes. So production of T lymphocytes and B lymphocytes, filtration of the lymph collected from the inner circle, and prevents the invasion of exogenous antigens. Coming to the terminal group or the deep cervical group of lymph nodes. So can you see here the internal jugular vein, and along the internal jugular vein or the carotid sheath there is a vertical chain of lymph node. So here you can see the vertical chain extending from the base of the skull to the root of the neck. So this is the root of the neck, this is the base of the skull, and here is the internal jugular vein. Along the internal jugular vein vertically lies the deep cervical group of lymph nodes. The terminal group or the deep cervical group of lymph nodes are divided into an upper group and a lower group. So the upper group, what is the demarcation? The upper group lies above the intermediate tendon of omohyoid. You can see the omohyoid here. This is the intermediate tendon of omohyoid. So those nodes which are above the intermediate tendon of omohyoid are called the upper group of lymph nodes. So in that, one of the important group is the jugulo-digastric node, and you have the mid-jugular node also. So these group of nodes which are above the intermediate tendon of omohyoid forms the upper group of deep cervical lymph nodes. So among that, one of the important nodes is the jugulo-digastric lymph node. The jugulo-digastric node is called the principal lymph node of the tonsil, because the tonsil mainly drains into the jugulo-digastric node. What is the position of the jugulo-digastric node? If you see, it is located below the posterior belly of digastric. So here you can see this is the posterior belly of digastric. Here we can see the anterior belly arising from the digastric fossa in the mandible. So this is the anterior belly, this is the intermediate tendon, and here you have the posterior belly. So here this is the posterior belly. This is the jugulo-digastric node. It is part of the upper group of deep cervical lymph nodes. This is called the principal lymph node of tonsil because most of the lymph from the tonsil drains into the jugulo-digastric node. That is why when you have tonsillitis and you palpate for the nodes, we find that the jugulo-digastric nodes are enlarged and also tender. So tender means they're painful when we touch. So here this lies in a triangular area which is bounded by the posterior belly of digastric. This is the internal jugular vein and this is a facial vein. So here the jugulo-digastric node lie in this triangle. This is what we just said now about the position of the jugulo-digastric node. Afferent vessels or most of the lymph from the palatine tonsil and posterior 1/3 of the tongue will drain into the jugulo-digastric nodes, and efferent from the jugulo-digastric node will drain into the lower deep cervical lymph nodes. So from the upper deep cervical lymph nodes also, lymphatics will drain into the lower deep cervical lymph nodes. And the lower group of cervical lymph nodes, they lie below the intermediate tendon of omohyoid. The upper group lies above the intermediate tendon of omohyoid or above the bifurcation of common carotid artery, whereas the lower group of deep cervical lymph nodes, they lie below the intermediate tendon of omohyoid or the bifurcation of common carotid artery. So of these, or among these lower group of deep cervical lymph nodes, one of the prominent node is the jugulo-omohyoid lymph node. And when we said that jugulo-digastric lymph node is the primary or the principal lymph node of the tonsil, jugulo-omohyoid lymph node belonging to the lower group is the principal lymph node of the tongue. So we can understand that most of the lymph from the tongue drains into the jugulo-omohyoid lymph node. Let us see the position of the jugulo-omohyoid node. Can you see the jugulo-omohyoid node marked there? It is, though we said it is the lower group is above the, below the intermediate tendon of omohyoid, we can see that the jugulo-omohyoid is located just above the intermediate tendon, and it lies on the internal jugular vein. So this is the jugulo-omohyoid node, that is the principal node of the tongue. The efferents drain directly from the tongue and indirectly from the submental, submandibular and upper deep cervical nodes. So which are the afferents which are reaching the deep cervical, lower deep cervical nodes? Directly from the tongue, indirectly from the submental, submandibular and from the upper deep cervical nodes. So whatever structures of the lymph that is drained by the submental, submandibular and the upper deep cervical nodes will finally end in the lower deep cervical nodes. And efferent from the lower deep cervical lymph nodes, the lymph is conveyed by the right and the left jugular lymph trunks. Right and the left jugular lymph trunks will carry the lymph from the lower deep cervical lymph nodes. Where do they carry it? We had seen this picture earlier. The right jugular trunk will join with the right subclavian trunk and drain at the junction of the right internal jugular vein and the right subclavian vein, whereas on the left side, the left jugular trunk will join with the left subclavian trunk. There is an additional trunk that is joining, that is a thoracic duct, which is only on the left side, and they will drain at the junction of the left internal jugular vein into the area that is a junction between the left internal jugular vein and the left subclavian vein. So that is how the lymphatics or the lymph collected from the head and neck are drained by these lymphatics into the junction of the internal jugular vein and the subclavian vein. Some members of the lower deep cervical nodes, what happens to them? They will extend along the brachial plexus and the subclavian vessels, and they will reach the supraclavicular triangle. And when these nodes they are present in the supraclavicular triangle, they are called supraclavicular lymph nodes. So these supraclavicular lymph nodes are part of the lower deep cervical nodes, and they reach the supraclavicular area or the supraclavicular triangle, which is also called the subclavian triangle, when they extend along the brachial plexus or the subclavian vessels. These supraclavicular lymph nodes, which are present on the left side, they are called virtuous lymph nodes. These virtuous lymph nodes are important because when we see the applied anatomy, we will see that enlargement of the virtuous lymph nodes should be taken into great consideration. You have to give a lot of clinical importance if you see a patient who comes across with if you see a patient who has an enlarged lymph node on the left supraclavicular area. So we will see that in detail when we do the applied anatomy. So first thing we have to know is that normally lymph nodes are not palpable. So if we have an enlarged lymph node, we have to examine the lymph node properly. We have to find out the cause for the enlargement, because there should be some pathology that is causing the lymph node to be enlarged and the lymph node to be palpable. That is, normally you cannot feel a lymph node unless there is a pathology. Have you heard of lymphadenopathy? Lymphadenopathy is a condition in which the lymph nodes in the body are enlarged. You can have either localized areas of lymph node enlargement or generalized enlargement of lymph nodes in the body. That means all the lymph nodes in the body can be enlarged at the same time. So here what you can see is an enlarged lymph node. This looks like a lower cervical group of lymph nodes that seems to be enlarged. So lymphadenopathy is a disease of the lymph nodes in which they are abnormal in size or consistency. So here you can see an enlarged lymph node. Now we have to find out why a lymph node is enlarged. There are multiple causes for lymph node enlargement. We have to see, when you see a patient with an enlarged lymph node, we have to find out the cause. These are the common causes we should keep in mind when we see a patient with lymphadenopathy. So it can range from malignancies to infections, some autoimmune disorders, unusual conditions like Kawasaki disease, sarcoidosis, and sometimes it can be caused due to certain medications, sometimes serum sickness, etc. So that is iatrogenic. Iatrogenic means that is induced by us. So malignancies can be like leukemia, lymphoma is a condition where you have generalized lymphadenopathy. That is, all the lymph nodes in the body will be enlarged, suspect lymphoma. Then metastasis, neoplasms. Metastasis means you have a primary somewhere else, probably the breast cancer. Patient has a breast cancer, but the lymph nodes of the axilla will be enlarged. So it means there is a spread or metastasis. Or metastasis means spread of the cancer from the primary site to the lymphoid tissue, to the lymph nodes. So you can have malignancies, infections, variable infections from bacterial, granulomatous, viral, other fungal, Lyme disease, many infections, autoimmune diseases. These are all the differential diagnosis, or these are all the things which should come to your mind when you come across a patient with lymphadenopathy, and the doctor should rule out the causes. You have to do investigations and tests and rule out the different causes and come to the definitive diagnosis. Next is lymphadenitis. We said about lymphadenopathy where there is enlargement and abnormal consistency. In lymphadenitis, it is an acute change where there is a pain and tenderness. Tenderness means when you touch that particular area, it will be painful for the patient. So, inflammation and an itis of anything means inflammation. Appendicitis, that is inflammation of the appendix. Cellulitis, inflammation of the subcutaneous tissue. Similarly, lymphadenitis is inflammation of the lymph nodes. So the particular area, what are the features of inflammation? You will have pain, tenderness and redness of that area. Also slightly increased temperature of that particular area. These are the features of inflammation. So you will see these features of inflammation on that area of or above the lymph node. So that area will be tender, red, sometimes it will be slightly warm and also very painful. Okay, so those are the signs of acute inflammation. And that enlarged lymph node may persist even after the infection is over. That is what we said earlier, lymphadenopathy. The lymph node may remain enlarged. It may not be painful. Once the infection is over, it will not be painful, but it can remain enlarged even after the acute infection or inflammation has subsided. So this is a feature of lymphadenitis, where you can see an enlarged lymph node, a group of the deep cervical group of lymph nodes which is enlarged. It is red in color and it might be painful to touch, that is tender, and it will also have a raised temperature because of the increased blood supply. So this is an example of lymphadenitis. Next is lymphangitis. Lymphangitis means the entire lymphatic vessel, that is the lymph vessel, is inflamed due to any cause. It can be infection, it can be inflammation, any cause. Usually it is infection. So here you can see a line. This line denotes the lymphatic vessel. So the entire vessel is involved. So that is lymphangitis is infection of the lymph vessel. Examination of the cervical lymph nodes are very important. You have to examine all the lymph nodes. So first thing, you have to make sure the patient is relaxing and the neck is flexed so as to release the tension of the muscles. If the muscles are tensed up, sometimes the lymph nodes may not be prominent. You cannot palpate them properly. So you make the patient flex the neck so that the lymph nodes can be easily palpated once the muscles tension is reduced. And when you're palpating, you note for things like enlargement. What is the consistency? Is it hard, soft? Is it matted? Then tenderness, mobility, and the number of enlarged lymph nodes. So when you know all these things, because you have a background of when the doctor has a background of the things he is looking for, he or she is looking for, and when he realizes the nature of the abnormal lymph node, that is, if how big it is, what is the consistency, tenderness, mobility, number of lymph nodes, and once the doctor has an idea what doctor finds out all these things, the doctor will know what are the possible site of infection, or if it is neoplastic, or if it is some other problem, or some other lymph node has to be examined to find out the cause for this, or some other area of the body has to be palpated. So all these things will come into the doctor's mind. So palpation of the cervical lymph node is very important. In addition to palpating the cervical lymph node, you have to palpate for the other lymph nodes in the body, which we had mentioned in one of the earlier slides about the inguinal, axillary lymph nodes. All the peripheral nodes should be palpated. In this picture, we can see how the submandibular lymph node, the middle jugular lymph nodes, the submental, and also the lower group of lower deep cervical lymph nodes are being palpated. You can palpate the patient from front as well as from behind to get the correct consistency of what you're doing. Next is regarding the verrucous nodes. Earlier we had mentioned that if the left supraclavicular nodes are enlarged, we should be very careful. Why is it so? This is because when there is a left supraclavicular lymph node enlargement, we have to suspect a malignancy, because the abdominal tumors like gastric cancer, they usually spread via the lymphatic system. So when these abdominal tumors from the stomach, for example gastric cancer, the abdominal tumors, they spread through the lymphatics and they reach the left supraclavicular lymph nodes. So there is a verrucous node. So if there is enlargement of verrucous nodes, you should suspect CA stomach, colon or testis. See here, from here the thoracic duct, will drain on thoracic duct is on the left side. So from here the lymph will be drained from the abdominal organs and they will be reaching the deep cervical lymph nodes here. So the upper deep cervical, lower deep cervical lymph nodes including the left supraclavicular nodes will be involved most commonly if there is a metastasis or spread of cancer from the stomach or the colon. So whenever you see the verrucous nodes are enlarged, you have to investigate the patient fully to rule out cancer of the stomach or any other GI tumors. Lymph node biopsy is often done for various diagnostic procedures. Earlier we had mentioned about the sentinel lymph node biopsy of the Delphian node, which is done during thyroidectomy. Similarly, when we are taking a lymph node from the posterior triangle of the neck, so this is the posterior triangle of the neck, if you are taking a lymph node from the upper part here, we have to be very careful to avoid injury to the spinal accessory nerve. So this is a spinal accessory nerve which is a sole motor supply to the trapezius muscle and the sternocleidomastoid muscle. So we should be careful when we are dissecting or taking a biopsy from this region not to injure the spinal accessory nerve. Similarly, the submandibular gland is located here. Sometimes we need to take a biopsy from the submandibular gland. So in that case, when we put an incision, we should be careful not to injure the mandibular branch of the facial nerve. So we know that the facial nerve gives its 5 branches here, of which the mandibular branch comes like this. It runs along the lower border of the mandible in front of the facial artery and the facial vein and comes this way. So when this part is dissected or part is incised to get a biopsy from the submandibular gland or submandibular lymph node, we should be careful not to injure the mandibular branch of the facial nerve. This is the clinical classification of lymph nodes depending upon the various levels. You have level 1 to level 7. Now what is the purpose of this classification? The surgeons who are operating on cancer of head and neck regions, they should be aware of the lymph nodes which are involved in a particular cancer. So depending upon the level of the lymph node found in a particular region, surgeons will know from which part of the head and neck region the lymph is being drained into that particular lymph node. You understood? So in order to improve the surgery or to increase the awareness of the surgeons, to make it easy for the surgeons, lymph nodes are arranged from level 1 to level 7. So level 1 we have the submental and submandibular, 2 upper jugular nodes, 3 middle jugular nodes, 4 lower jugular nodes, 5 posterior triangle nodes. By these jugular nodes we mean those deep cervical nodes. Okay, so upper deep cervical nodes, middle cervical nodes and lower deep cervical nodes. Posterior triangle nodes, that is the supraclavicular nodes. Level 6 includes prelaryngeal, pretracheal and paratracheal nodes, and level 7 are the nodes in the superior mediastinum and suprasternum. So when the surgeons are aware of the level of the lymph nodes, they will know from which organ the lymph is being drained into these lymph nodes. So depending upon that, they can trace the origin of the cancer or the primary or the secondary, whatever it is. By knowing the level of the lymph node, it is easy for them to know from which organ has a primary cancer or the metastasis. Now here we can see the various levels. This is level 1 divided into level 1A and level 1B. 1A is for submental and 1B is for submandibular. Then level 2 was upper jugular, that is the nodes around the upper 1/3 of internal jugular vein. Then we had the middle jugular, where these are the nodes involved around the middle 1/3 of the internal jugular vein, and the lower jugular, which involved, that is level 4, which involved the nodes around the lower third of the internal jugular vein. Then we had level 5, which is a posterior group. That is in the posterior triangle here, we have the supraclavicular lymph nodes. Level 6 included the This is it. The pre-laryngeal, pre-tracheal and the paratracheal lymph nodes. And level 7 further down, it was the suprasternal and the superior mediastinal lymph nodes further down. So these are the classification of lymph nodes, clinical classification according to the levels. Next important applied anatomy is about the classical block dissection or the radical neck dissection. So here what is done is a lot of structures, the entire area between the lower from the mandible to the clavicle, the excised area, the area of excision will extend from the mandible to the clavicle and from the lateral border of the strap muscles of the neck to the anterior border of trapezius. So it is a pretty extensive area. So clearance of all the cervical nodes and removal of the adjacent structures in this extensive area. Why do we do that? To arrest metastasis from carcinoma of the lips or mouth. So from the lips and mouths, carcinoma spreads to these regions through the lymphatic spread. So when there is a block dissection done, the area between the mandible and the clavicle will be excised, and between the lateral border of the strap muscles in front and the anterior border of trapezius behind. But certain structures will be preserved. Those are the carotid artery, then the mandibular branch of the facial nerve we said earlier. Then we have the vagus nerve, phrenic nerve, hypoglossal nerve, and cervical part of sympathetic trunk. So the mandibular branch of facial nerve, vagus, phrenic nerve, hypoglossal nerve, and the cervical part of sympathetic trunk. In addition to that, the carotid artery. These structures will be preserved, but all the other structures and all the other cervical nodes will be removed in order to prevent the metastasis. These are more modified form. There earlier it was a block dissection where there was extensive removal of structures, whereas depending upon the stage of the patient, you can have modified radical neck dissection where they clear only level 1 to 5 nodes, or you can have selective neck dissection where only selected group of nodes are removed. So what kind of a surgery has to be done is left to the discretion of the treating doctor depending upon how he can carry on the surgery for the benefit of the patient. So depending upon that, the type of surgery will vary. Let us see each of these nodes which are extensions of the pericervical collar. First, facial nodes, also called buccal nodes. These are offshoots of the submandibular